Concerning these diseases and the vectors that carry them, and malaria is not a viral disease, is it? It's
a
protozoan. And I understand that the drugs to treat it, the malaria is becoming resistant to drugs to treat malaria.
Correct.
So that means we're looking for new drugs. The dengue is a viral thing.
Right.
Is it possible to get for example, a vaccine against dengue, or?
There are vaccines that are in the midst of clinical trials. To my knowledge, they have not yet been approved by the FDA, but there are a couple of trials there are 4 different viruses that are similar, but they're different genus and species, if you will. So a vaccine has to vaccinate someone against all 4 forms of dengue. And so there is a tetravalent vaccine that's undergone clinical trials. It's about 65% effective. It varies according to the strain of the dengue virus. The trials were conducted under optimum circumstances. It required multiple injections of the vaccine, and the people who ran the trial went with public health nurses and workers and picked people up and brought them to the vaccination center. So it's not a realistic scenario for the real world. It's difficult to say how effective that vaccine will be under real world circumstances where people, don't come to get their vaccine or don't come back for the 2nd or 3rd dose. And it's going to be expensive. The estimates are that it's going to be somewhere around $20 to vaccinate one person, assuming that the vaccine maker doesn't charge $6,000 a dose like their drug manufacturers are wont to do with many modern medications that you and I have paid for in the development in our taxes through funding to the National Institutes of Health and others. So there are vaccines for dengue on the horizon, and there's intense work on vaccines for malaria, which is caused by a protozoan, not a virus or a bacterium. It's much more complicated because the life cycle of the protozoa that cause malaria is much, much more complicated. Yes?
As far as the malaria goes, my sister goes to Africa every year. She's involved with some hospitals there. Malaria there is like getting a cold here, but they don't have if you get malaria here, you can be treated, but they don't have the way to treat people.
There were huge setbacks in the World Health Organization program for combating malaria at the time of the worldwide financial crisis from 2007-8. The countries, just weren't giving money to the UN to do that. But there are effective ways of dealing with malaria that can reduce the risk, like using insecticide-impregnated bed nets, so that mosquitoes don't bite you at night or your children at night. Children under 5 are the most susceptible. Giving anti-malarial treatment to women who are pregnant so that they don't have a baby that's already weakened by the mother's repeated doses or bouts of malaria. Seemingly simple things like draining standing water, which is where mosquitoes breed. There are lots of relatively simple things that can be done that, when taken together, are referred to as integrated vector management, IVM. And many of these things are cheap, but you have to be able to instruct people how to do it, and there has to be follow through, and preferably with public health workers going out to make sure that it's done correctly and in a timely way. And one of the other things that's happening is that there's a burgeoning field called, blocking on the name, where disease ecology. And some of the most sophisticated examples of this, a disease ecologist will take information that's gathered by satellites that show that it's likely that the physical conditions, the weather conditions or climate in a particular part of the world is beginning to favor vector proliferation, and then you can instigate more intensive vector management programs in that area to retard the spread of diseases like malaria. So
It costs money though. That's
costs
the thing.
money, right? And President Trump says we're not going to be spending money on that. They're cutting foreign aid through the State Department, and I guess if you wanted to build a new atomic bomb, you probably could get a
Sure.
grant to do that. But
Build up our
to
nuclear
build,
arsenals, we have the money.
yeah, insecticide. Sorry. Yeah. Go ahead. You decide.
First, I'm not, I wish you would say something that would be optimistic for me, because I'm very pessimistic about the depopulation plans for our government worldwide. For instance, Africa has 54 different countries, so there are different protocols going on in different parts of the world. We often think that America is doing good things. But in India right now, you have 2,000 Indians committing suicide a month because those farmers are no longer allowed to use their heritage seeds. They must buy their seeds from Monsanto and Cargill. Or else they face government, horrible government imprisonment in the whole 9 yards. So now you've got these people taking loans out to buy Monsanto and Cargill seeds that are GMO. And the people are committing suicide because they cannot afford to pay back the loans. You had the same thing going on in Tanzania, East Africa. You had the same thing going on in Mexico. Mexicans now have to buy their corn from Texas because they're no longer allowed to use their own heritage seeds to grow corn for their own tortillas. We've got, I don't know if you're familiar with the granite stones in Elberton, Georgia. Right in Georgia, they have a monument, granite monuments that said the population should be maintained at 500,000 or less. You've got Henry Kissinger going around saying that elderly people are useless eaters and they need to be exterminated. You got Ted Turner and Bill Gates going around saying that the world population is too big, and by 2030 there should be 1.9 billion people eliminated through wars, starvation, and water shortages. And I am very, very suspicious of World Health Organization. I've been in Africa for 2 years, and AID, I see what they've done with vaccinations. I've seen Nestle come in and convince African women to stop doing breastfeeding, but to use Nestle formula for the babies, and the babies are dying like flies because they think this is a sophisticated way to go. I am very, very suspicious of the vaccination program that we have. So if you can say something that cheers me on, not just Trump, I think Trump is getting ready to be moved out of the way by
My
Pence.
medical training sort of requires me to be optimistic.
I hope
and
so.
be supportive
Well,
of
please,
people who come to me for assistance. And I think, if we just all throw up our hands and say there's nothing we can do, there will be nothing that we can do. So we have to go out there. I think as a part of our individual responsibility, and I list this as a sort of a core responsibility of medical professions. We learn stuff in medical school and the practice that can be used to improve the health and well-being of other people. And it's a part of our obligation to do that. I think each one of us in here has some level of expertise and a level of energy that we can commit to this. If we don't, things inevitably will get bad. Yes, ma'am.
But all of us that are here are relatively comfortable, so that we understand that we have more options than others have. Now, here in Youngstown, I'm curious how Overland mobilized in order to have their energy be from geothermal, and in order to influence that. Because here in Youngstown, we beat our heads against the wall because everybody here, from all of the officials, all of the union people, think that natural gas is clean energy, that extracting shale in the manner that it's done, disposing of it, Youngstown being a big waste dump, that I don't, how did you mobilize
Well, the
that?
geothermal energy project is the result, and John can correct me on this, but he lived there at the time that this was beginning, the result of the actions of the 325 or so people that live in the Kendall community where we live, who saw it, we're a relatively affluent group of people, we can afford to live there, and we're going to do what we can to minimize our carbon footprint. And one of the ways of doing that is to, bite the bullet, so to speak, and pay for the installation of geothermal wells and energy climate control systems in our community. It's not the entire city of Oberlin, it's on geothermal. Did you have a question?
It's a really specific, are the Centers for Disease Control, is that also funded by the NIH?
It's not funded by NIH, but they're under the Department of Health and Human Services.
They are.
Yes.
The most important question I have is, she mentions mobilizing, but even before that, what is the way you get just people interested? For instance, I don't know how many here there are, say 45 or whatever it is, but there really ought to be 1,000 people here, right? How many people here were not already interested in the environment? How many people here were not already interested? Nobody.
Well, this is a church, so I'd say we're preaching to the choir here.
Yes, we are, but how do we get more people in the choir?
Yeah, people go to church and they hear the choir sing, so that's what we have to do. We have to, spread the word, letters to the editor, appearances on radio broadcasts, op-ed pieces that we write, letters, probably physical letters are not as effective as they used to be because it takes so long to get there. But email and telephone calls to members of Congress, meeting with congressional representatives and their staff when they come in the district. And if they don't show up, show up outside of their office, sooner or later, they have to do the right thing if they want to get elected. Janet, I think you had your hand up.
Yeah, I just wanted to make an observation. As I've gone around and talked to different groups, I am seeing groups springing up all over the place like mushrooms. And every place I go, I talk to groups, I say, who here has never been involved in a political action? And there are always some people, maybe there aren't here today, but there usually are some people who have never been involved in any political action. People are starting to wake up. That's the good news. I had the privilege of going to a climate conference at Oberlin College, a 3-day conference in October. And the takeaway that I got from that was that we can still save ourselves, but it's going to take an effort on the lines of the Second World War when everybody was pulling in the same direction. Now, with this president, that is not going to happen. But what we can do and what we must do, the first thing is address the gerrymandering problem, because right now we have safe districts where these representatives are not accountable to the people because they know they can do whatever they want and they will still get reelected. Now, if you want to get involved with helping with gerrymandering, contact your League of Women Voters. They are working on this. There are several other groups that are working on this, but this is the first thing we have to do before we can address anything else, in my opinion.
I have something that everybody can do that I just wanted to mention. So last year, the EPA set up methane emissions standards, which we only had carbon standards, and now they are going to be eliminated. So the Senate is looking at that, and we all have Senator Portman, if you're in Ohio, and he has actually not made up his mind, he says, about voting for or against that. So I think it'd be really good if we all called, emailed.
Calling his office is good.
Yeah, call his office or email his office, and just have to Google Rob Portman and you'll get his
There's
his
a
website.
there's a contact us link on virtually every senator and member of Congress.
Yeah.
Click on that, and then there'll be a little box that you can fill in. You have to give them your name, your email address, where you live. You might have to put your zip code in there to gain access to that, because they don't want people from the outside faking residency. They want to hear from their constituents. But they do pay attention to that
Yeah.
stuff.
And that's something we should do this month.
Yeah.
And just tell them you want the methane standards to be kept in place.
Does anybody know, is there going to be a town hall meeting when the April,
For Portland,
yes,
Portland is only meeting with small groups, usually donors. In Cuyahoga County, we had a make-believe town hall where there was a picture of him because he refused to have a town hall. So, I don't ever remember him having a real town hall.
I'm going to let somebody else be sort of a moderator here, because I was led to believe that there might be a business meeting after this.
That's the perfect segue.
Yeah, but I am available, and if you want to come up, I'll give you a business card. I'm happy to come speak to other organizations if we can work out a time.
Ask a question about over in Ohio. I believe it was the city council. It was very instrumental in the changeover. But you can contact Dr. David Orr at the Environmental Center.
You can talk to me.
Give you contact
I'll
names.
answer.
But I do want to close with one health issue, because it is relevant to Pennsylvania and Ohio. Just the Lyme disease. And I think, just from my understanding about its spread, is that it is worsening, it's intensifying because of the heat issue. And I'm wondering if there is research and development that is being done, because I understand the ramifications and health impacts are very diverse.
Lyme disease is spreading because the vector, the little ticks that carry it are spreading. If you look at the map of the spread, it sort of starts out in Lyme, Connecticut, and it expands like this. And as the climate is changing, additional areas that were not hospitable to the vector are, and it's spreading too. West Nile virus, another one that it's also a mosquito-borne illness, St. Louis encephalitis, yellow fever. There's a really long list of diseases that you don't want to have. So let me close again by saying thank you to all of you for coming today, and to FACT for organizing this meeting and issuing the invitation. My email address is A for Alan, H for Herbert, L, Lockwood, ahl@buffalo.edu. I'd love to hear from you.
Thank you.
Thank you, Ellen.